You are listening to the FORSCOM Frontline, bringing you to our soldiers on the front lines of readiness. Hey everyone, welcome to the FORSCOM Frontline. I'm Ashley and I'm your host. October, among other things, is Breast Cancer Awareness Month. And according to the CDC, breast cancer is the second most common cancer among women in the United States. And although rare, men can also get breast cancer, and about 1 in every 100 breast cancer diagnoses in the U.S. are found in men. And again, that's according to the CDC. Today, we are joined by Colonel Birgit Lister. She is the FORSCOM Chief of Clinical Operations and the FORSCOM Chief Nurse, and also a breast cancer survivor. And she's here to share her story today. So welcome, ma'am, and thank you for joining us.
Thank you for having me.
Thank you for being willing to share your story with us.
Sure.
So before we get too far, sorry, I still struggled with your name. It's from Germany.
Yes.
You are from Germany. It's
yes.
German. You're from Germany. So before we get too far into our conversation, can you tell us a little bit about yourself and your role here at FORSCOM?
Sure. I've been on active duty as a nurse corps officer for getting close to 22 years. I've been here at FORSCOM for a little over 2 years, and I'm I work in a surgeon directorate here, a small team of about 16. I'm the chief of clinical operations and also the chief nurse for FORSCOM.
And so what does that mean for our listeners, clinical operations?
So we look at medical readiness.
Okay.
Of course, COVID has been...
Oh, I'm sure.
Up front, right? All things COVID. We're looking at medical documentation systems in the operational world.
Okay.
Assignments as far as MAP. It was used to call ProFIS, where medical providers are pulled from MTFs then to deploy. So that encompasses what we do in clinical operations.
Okay. And so I already mentioned it, but October is Breast Cancer Awareness Month, and you're here to share your story with our listeners.
Sure.
You've survived breast cancer. Can you just walk us through your journey?
So back in 2015, I had just PCS actually from Womack to Fort Belvoir, and I worked at the Regional Health Command at Fort Belvoir. And that was in September. November, I did my annual mammogram. In the beginning of December, I was notified, hey, you need to come back. We need to do additional films. So I had a repeat mammogram. And at that time, the radiologist read that mammogram right away, and then they suggested, let's do an ultrasound. At that time, they did see something that they didn't see in my past mammogram, so they suggested to do a biopsy, which I did the week of Christmas, actually, in 2015.
Wow.
And I already had an appointment to get my results on the 4th of January, 2016, and that's when I got my diagnosis.
Okay.
Never forget that date.
Oh, I'm sure.
So things kind of moved fairly quickly after that. The same week, I had a appointment. It was a multidisciplinary appointment with a radiology oncologist, the oncologist, the surgeon, physical therapy was there, nutritionist was there.
Oh, wow.
Social worker was there. So it was pretty much an all-day event.
Wow.
Where we discussed my care plan, essentially.
Okay.
So 2 weeks after that, had a lumpectomy. For my type of cancer, it didn't require chemotherapy, so I was very happy when I heard that.
Yeah.
But I did have a lumpectomy, and I had 20 rounds of radiation after that. But there was about a 2-month span between the surgery and starting the radiation, because they want you to heal, right?
Sure.
It's a surgical process, so
Sure.
they want you to heal. So, yeah.
So you said that they had found the lump that they hadn't seen previously. How
Yes.
long had it been between your
A year.
appointments? That's it?
A year.
Oh, my goodness.
Yes. And
How
it was
crazy.
very small. They found it very early.
Well, yeah.
Basically the size of my fingertip. And,
Okay.
honestly, I did not feel it. until I knew where it was, and then I could feel it.
Oh, wow.
Yes.
Oh, you're giving me goosebumps. So one of the things you mentioned, though, that I thought was interesting is that you saw a nutritionist.
Yes.
I wasn't expecting you to say that. What was that? What was their role in your...
It was essentially there was an introduction if I had any questions to come back. Same for the physical therapist.
Okay.
With radiation, you can have some... it can have some impact on your shoulder mobility, especially on the side where the radiation
I guess
occurred.
that makes sense.
Yes. So, and I had some significant issues there, but thankfully that kind of resolved with some physical therapy. So.
Sure. So, one of the things that we've talked about before is when you got your diagnosis, you weren't sure what that meant for, continuing to serve. Mm-hmm. So, can you just talk a little bit about that and what you found out?
Sure. So during that long appointment, that time, right? So I had a couple days to kind of digest the diagnosis.
Sure.
And then go into that long appointment. So one of my questions was, will this trigger an MEB? Will this, stop me from continuing to serve?
Yeah.
And no, it does not. They want to make sure you're go through all the treatments that you do. I was on a profile very limited time, actually.
Oh, wow.
It does not trigger an MEB, so I think that was my biggest fear.
Sure.
And even as a nurse, I did not know, if that was the case or not.
Yeah.
This was completely new to me, so.
And one of the things I thought was, would it warrant somebody going to a wounded warrior or that sort of transition?
Depending on what kind of treatment you have to go through, it could potentially, if you have a lot of complications.
Sure.
But if you have a pretty benign course of recovery, it typically does not.
Okay. And one of the things you, again, mentioned is, so talking a little bit about your recovery, you may have rushed a little bit too quick into that first PT test.
Yes. So, like I mentioned, I was on a profile for a very short period of time. I had my surgery. I think I was home for about 10 days, and then went back to work.
Wow.
And even during radiation, so where I worked in the hospital was right next door. So I would come to work a little bit, and then have my standard time. You have the same time every day. It's Monday through Friday. And would just walk over to the hospital, get my radiation, come back, and work.
That's so crazy to think about. I mean,
right.
It makes sense, but I think what goes through my head is you just never know what somebody's going through.
Right. And very few people actually knew.
Yeah.
They knew I had some kind of surgery,
Yeah.
but most people didn't even realize what I was doing every day.
Yeah.
So in hindsight, I think I should have taken more time. But I think we're all kind of type A people. And we just want to do the right thing for our jobs.
Yeah.
And so radiation does have some effects on your body. You could have some redness for the area and irritation. Thankfully, I had very little of that. But it causes fatigue, and it's cumulative, right? So the longer you do radiation, you get tired, and even after radiation is done, you still have some lingering effects.
Sure.
So hindsight being 20/20, I probably should have slowed down a little bit, and then so my diagnosis was in January, and in early June I took a PT test. And this was not forced upon me by any means. It was more, I think, me wanting to prove myself that I was okay.
How long after radiation ended to when you did the PT test?
2 months.
Oh, okay.
Yes. Probably not an example people should follow.
That's funny. So another thing is you were having your yearly mammograms.
Right.
So early detection played a huge role. But also, breast cancer is something that is often found within families. According to the CDC, a woman's risk of breast cancer is higher if she has a mother, sister, or daughter who has had breast cancer before. So can you talk about how that played into how you were staying routine with your exams? I guess that's the word I'm looking for.
So my sister was diagnosed about the same age that I was diagnosed with breast cancer. So she's 10 years older than I am. So once I knew, of her diagnosis, I made sure I talked to my PCM, and I started annual mammograms fairly early. I was in my late 30s.
Oh, wow.
I was very conscientious about going every year.
Yeah.
And that particular year, I was actually a month late.
Oh.
But I think the fact that I did go every year really contributed to it being found very early.
Yeah.
So
my grandmother had breast cancer twice, so I know that is within my family history. But I'm 36, so I'm still just going for, like my annual. Do you have, from your nurse perspective, how often should we be doing these exams?
So I actually, once we had talked, I reached out to my oncologist at Womack just to make sure that what I'm saying is correct. But her mention was body surveillance, right? And this is for men and women. If you find a lump, just be aware of your body, right? If you find a lump that persists, that is there for 3 or 4 weeks, go see your PCM.
Yeah.
Body surveillance is basically the first thing everybody should do. Also be on the lookout for other symptoms. So swelling of all or part of a breast, skin dimpling. So sometimes that will look like orange peel.
Oh, okay.
That texture. Breast or nipple pain, nipple retraction. So an inverted nipple, for example, is a sign. Could be a sign. Nipple or breast skin that is red or flaky or just different than what it's been.
Okay.
And nipple discharge or swollen lymph nodes under your arm or in your collarbone area. So those are all symptoms that everybody should be looking out for.
Okay.
So listen to your body, right?
So this is men and women.
Absolutely.
Because I think, so I've paid attention to breast cancer because my grandmother and I was in a sorority where our philanthropy was breast cancer awareness. But we always drive home, women need to be doing our self-exams and we need to do this and that. Can men do self-exams?
Of course.
It sounds like a silly question after I said it out loud, but.
Right. So, I mean, like I said, body surveillance. I know that sounds kind of strange, but
no, it totally makes sense.
If you feel something that hasn't been there, pay attention to it, right?
Yeah.
Your body's trying to tell you something.
Yeah.
Also for mammograms, so there's different guidance out there. I would recommend that you talk to your PCM and they will consider what your risk is based on your medical, your family history.
Sure.
And kind of go from there.
Okay.
But certainly make sure that once you know what the expectation is, right, if it's yearly or every other year, make sure that you make time to do that.
And, I'm glad you mentioned that because as moms, it's very hard to think about ourselves.
Absolutely.
And I know we're talking about men and women, but just from my perspective as a mom, it's very easy to get my child to their yearly exam. It's something I have to do. But when it comes to me, I'm like, I got work and the kids have this and that. I can push it off. But those exams are crucial. Early detection is what really saves lives.
Absolutely.
Okay. So, you have a family history of breast cancer. So you went into this with somebody, a family member who had recently gone through it as well. How did that support and that understanding from your sister really help you through your journey?
It was very important just to hear what everybody unfortunately, she had to receive chemotherapy, so we had, and of course, it's been 10 years earlier.
Yeah.
Right? So things changed, treatments changed, and she was still in Germany. So we're not sure what type of cancer, because there are different types of breast cancer, right? But, I mean, I'm thanking her because if I had not done the yearly mammogram, I probably would not have found it as early as I did.
Yeah.
So, and, you know, for my daughter, I have a daughter, I make sure that, and she's, 35 now, so, you know, I told her, make sure you tell your PCM that you have a family history, so not only your mother, but your aunt as well.
Yeah.
So you have two people.
Oh, it makes me think I hate that we have these things, you know, and that, I mean, it's great that we can prepare and we can have that knowledge that, you know, this is in my family history and we have early detection and that really helps. But just the fact that, you know, I don't know, it stinks.
Yes. So thankfully, they did genetic testing for me.
Okay.
I do not have the breast cancer gene, so that's...
Oh, awesome.
That's good.
Yeah.
But it still leaves a risk factor for my daughter, right?
Sure.
And potentially for my son, right?
Right. Again, we forget about that part. Right. And I have a son, and it's so hard to think about that. And I mean, 1 in 100 isn't nothing, that's for sure.
Yes.
So we talked about early detection, and we talked about self-exams and the wellness appointments. We talked about family history. We talked about support. So what, you know, it's Breast Cancer Awareness Month. What would you say to listeners? You know, you're a nurse. You know, what would your message be to them?
So I'm going to steal a line from my oncologist, right? No one is too early to have, no one is too young to have to have cancer.
Yeah.
Any type of cancer, but breast cancer, right? Listen to your body.
Yeah.
Body surveillance, as I talked about, and early detection saves lives.
Yeah. You know, I think we covered everything.
Yes.
Is there anything that we didn't talk about that you think is important to mention, again, being Breast Cancer Awareness Month?
No, I think we covered it all.
Okay. Yeah, I think so too. I really appreciate you taking the time just to share your story, because I think hearing it from somebody who has gone through it, and that early detection matters. It
Absolutely.
Makes a difference. Is really important. So I thank you again for doing this and being open to sharing your story.
No problem. My pleasure.